Hi, I'm Val and this is Josh, and we're going to be discussing our narrative about Joe's journey. This is a book about Joe who has Duchenne's muscular dystrophy. It follows his journey from birth to the final stages of his disease. We wanted to incorporate the financial costs that come with this disease in their respective stages. And hopefully this narrate highlights the experience of a patient with insurance and without access to insurance and how that can affect the family, the economic burden, and their family dynamic. We noted that in the narrative, we noted that clinical trials are important for patients with DMD, and we included how their participation can change the outcome and the expenses that they have to undergo. So we're gonna get started. We divided the stages into four: the early ambulatory, the late ambulatory, early non-ambulatory, and late ambulatory. So starting with early ambulatory, we noted that Joe was a normal baby coming out of the hospital. He was brought home completely healthy and continued to show signs of a well-developing baby. He was able to cry, roll over by the normal age, crawl at 9 months, and walk at 15 months. Some of the milestones were slightly delayed compared to the average, but it did not arise any concern with the parents. By age 3, they did notice that he was falling down more, had more weakness. He complained of being tired, and he was using his arms to get up off the floor, and his parents noticed that, but decided to wait to take him to the doctor. Until he was 5 and he started kindergarten, it became more apparent that he was unable to keep up with the other kids his age, and he just complained of being insatiably tired. When his parents noticed that he was struggling to get out of bed and it was becoming too difficult for him to walk, they took him to the doctor. The doctor noticed his decreased muscle tone and decided to get a creatine kinase serum test done, which showed extreme elevation and caused concern for the doctor. So he decided to continue with tests and send him to a neurologist. They continued to do testing such as a muscle biopsy, the immunohistochemistry analysis, and a Western blot, which was all pointing to Duchenne's muscular dystrophy, but finally the genetic testing established that it was Duchenne's muscular dystrophy. At that point on, he started corticosteroids, and his family was advised of ways that they could help him, such as like nightly stretching and low impact exercises to prolong his muscle health. And then from the ages of 5 until the early non-ambulatory stage, his family was very supportive in helping him stretch. They took him to physical therapy. Joe started swimming more often so that he could exercise without straining his muscles. But they did notice that his walking became harder and harder. He was walking on his toes more and using his arms to get up from the floor. He was unable to abduct his legs when laying laterally. And he continued going to school, but they had to make accommodations due to his fatigue. So he went to school 3 times a week and had remote learning for 2 days of the week. They did also notice that he had some developmental delays, so they started tutoring and just offering extra help for him. And now going into the early non-ambulatory stage.
Yes. So in the early non-ambulatory stage, Joe's DMD progressed. So he continued to see these different changes in his symptoms as he went from ambulatory to early non-ambulatory. He was diagnosed with this stage after falling and losing balance repeatedly, as his muscles in his legs revealed greater weakness. Um, one typically becomes non-ambulatory by the age of 12, but because Joe started prednisone earlier on, he lost his ambulation by the age of 14, which was delayed 2 years after he normally would have had he not taken the steroids. Um, as we continue to page 8, his DMD progression continued. So he sought out different specialists to treat the different organ systems that DMD affects. On this page, specifically, he sees a pulmonologist, a cardiologist, and a musculoskeletal specialist. Different diagnostic tests were performed, like EKGs, or cardiac imaging, or pulmonary function test. And then they use that to either further diagnose his symptoms, adjust the dosages of medicines being treated. For example, in this case, his dosage for prednisone was increased by doubling, taking it morning and night instead of just once a day, to then further delay any loss of ambulation or weakness in his muscles. As we continue to page 9 and 10, these pages sort of just continue to describe how he sought more healthcare professionals' advice, and he began to go to physical and occupational therapy to adjust to his new loss of functions and prevent any further muscle shortening or stiffness, so that he could still continue to live out daily habits. He saw a respiratory therapist to assist in his breathing. And this image specifically, you can see that he is receiving non-invasive ventilation. So yeah, he just continued to see these different medical health professionals to continue to monitor and track the progression of DMD. By page 11, this page's purpose was to highlight and highlight the importance of continuing to perform activities and hobbies that he once enjoyed before his DMD progressed. It emphasizes the need for a support system through his friends and family and therapists, so that not only his physical health can be strong, but also his mental health is just as important. As we continue to chapter 4, this is a further progression from early non-ambulatory to late non-ambulatory. And so the big contributor to this differentiation is in late non-ambulatory, Joe was not able to complete any bit of the 6-minute walk test independently. So he was strictly bound to a wheelchair. And then we continue to see the progression of weakness and stiffness from not only his lower extremities, but up to his upper extremities as well. Overall, it's sort of laid out in this narrative similar to chapter 3 before. He continues to follow up with these different specialists. If we move on to page 14, you can see he still has these cardiac issues that have become more apparent. He still has these musculoskeletal issues. In this case specifically, we highlighted how he has scoliosis, which worsened over time and ultimately has changed his posture. And then you continue to see that he's still going through different diagnostic exams here, different imagings, the EKGs or ECGs as well as getting different blood types to monitor those hormones that play a factor into DMD. If we continue on to the next page, this goes on to show how not only are his physical symptoms again important, but as his lifestyle has changed, he has to further adapt to changing some of his lifestyle choices. Specifically, it was advised that he sees a nutritional specialist just to ensure that his BMI is at a healthy weight throughout this process. Furthermore, he also receives palliative care, which isn't for just end of life, but in DMD, the doctors advise that you can have palliative care come assist you at any stage in the process. But in our narrative, we chose for it to occur at stage 4. just to assist him with some of those life habits, such as like going to the restroom or taking a bath that he once used to be able to do independently, but now since DMD has progressed, he can no longer do on his own. So that continued over time. And then he also, again, his mental health is still important, and not only his, but his family, as all of these financial burdens and paying for these different treatments and diagnostic exams have added up over time. They begin to seek treatment through different therapists in which they're able to talk through it and approach, his treatment progress together. And then lastly, in this chapter, Joe chooses to enroll in Exondys 51, which is a experimental drug that not only helps people who are ambulatory, but it can also help people who are non-ambulatory as well. It aims to skip exon 51, and then ultimately that leads to the reduction of dystrophin. Usually it leads to improvement in the 6-minute walk test, but for Joe, because he's already non-ambulatory, it ultimately just further delays the progression of DMD declining his respiratory system. And then, this page just further continues to talk about how he is enrolled in that treatment. Once he's enrolled in that treatment, with it being experimental, it is free. However, this treatment now is on the market and owned by Sarepta Therapeutics, and the cost has drastically increased to $1.3 million per year. So this further emphasizes the financial barrier that different treatments, especially groundbreaking treatments, have on individuals when trying to get access to healthcare. And then ultimately, Joe is finishing this narrative as he's continuing to fight DMD. And in this non-ambulatory stage, he's surrounded by his family, friends, and different teams of healthcare professionals that are all there to support and encourage him, to give him the resilience to keep strong each and every day.
Yeah, so a little bit of more information on the clinical trials. We learned that participants in clinical trials have standard of care, which means that the company or the pharmaceutical company that is doing these clinical trials will typically take care of all of their medical needs in order to prevent any confounding variables that might occur if they were treated in other places or with other providers. They also typically cover the costs of transportation and any accommodations that they might need, which is a big relief for a lot of families with a patient with DMD. So that's why clinical trials are such a symbiotic relationship between patients and pharmaceutical companies. In this case, pharmaceutical companies will get more medical research and further insight into the mechanisms of disease, and patients will have hope for a therapy that might work for them. In the case of Sarepta Therapeutics, they developed Exondys 51, which skips exon 51 in patients with DMD, and it makes muscle fibers positive for dystrophin. The approval of Exondys 51 was controversial because it was accelerated, but the clinical trials found that there was no adverse effects and there was significant improvement in the 6-minute walk test when experimenting on ambulating patients. Because of this, the approval was granted and they were able to move forward with Exondys 51 to sell to the public market. And as we touched on earlier, the cost when you're not participating in a clinical trial is $1.3 million per year, and that's $847.15 per milliliter. And typically the dosage is 30 milliliters every week. So you can see how that would add up and how newest drugs are very beneficial, but they're also very expensive and sometimes inaccessible. Next, we're talking about the breakdown of every price for every treatment that we discussed in our narrative, starting with the diagnostic tests such as the CK test, seeing a neurologist, a biopsy, the genetic testing, all of that adds up. And then there's the prednisone, which is not just a one-time thing, it's a reoccurring medication that they're going to need for life. So that is a price that also adds up. And as we continue, things like prednisone, the dosages increase, so the price increases. And then there are more invasive procedures that have to be done, which cause the pricing to increase as well, such as the wheelchair, more frequent physical therapy, more frequent occupational therapy, and orthopedic bracings in the late ambulatory stage, the ventilation as well, and of course the palliative care as they near the end of the disease. We also included the Sarepta therapeutics because it is such an expensive treatment. Not every patient can afford this. So the total bill before including Sarepta would be 116,587. Without insurance coverage, they would be paying that out of pocket. And then if the patient chooses to start Exondys 51, their annual total would be about 1.4 million, which is extremely unattainable for the normal average person. But then we wanted to calculate with insurance. We focused on Medicaid because it's the most accessible insurance. So, but we found that most insurances, whether they're private or federally funded, take have a 20% out-of-pocket cost to the patient. So that's how we kind of calculated from the total, we took 20% of that, and that would be the out-of-pocket cost. So again, after insurance coverage, the total would be 24,000 without the drug, and then with the drug, it would be 288,000. Although the insurance reduces the number significantly, it's still an extreme financial burden for families and often unattainable. So we just wanted to highlight that it's a significant barrier that adds to the burden of this disease.
Yes, and so also as we look at the pricing of DMD, if we go back to the chart, basically some further background knowledge on how we laid it out was we wanted to look at the products, which are those diagnostic tests and treatments that Joe, through this narrative, had experienced. And as you look at this, our hope was that would almost represent a receipt or bill that someone would receive from receiving care for DMD. We start with the products that Joe initially faced in stage 1. And as you continue down the chart, it goes all the way through the late non-ambulatory stage 4 phase. As Val expressed, we laid it out with product cost, total yearly, and then total insured. For the cost column, that alone is either the individual cost or monthly cost that receiving these diagnostic exams or treatments are for the patient. And so we use the different dosages to calculate a total yearly cost, and then how frequent they are as well. For example, if you see a physical therapist, it's recommended that you see them 3 times a week. So you multiply that cost by 3 for 52 weeks, and then you get the total yearly cost. So we had to approach this using the research we found online, and then we itemized everything, and then we did further calculations to sum it up to the yearly cost so that then we could calculate the insured yearly cost and ultimately add it up to the total cost as well. So yeah, that's just some background on how we were able to calculate these numbers. and with what research. If we continue now to the pricing, this goes more into our conclusion. But overall, through Joe's narrative, we hope to have illustrated how treatment costs can act as barriers when accessing healthcare. Our calculations through the chart revealed a stark difference in the total cost for uninsured versus insured, with $116,587 and $24,122 being the total cost respectively. These costs align with the ranges past researchers have concluded, which reaffirms and validates the data and research we performed. We incorporated Exondys 51, the experimental treatment, to emphasize how new medicine can outprice patients coming from low-income backgrounds, limiting the treatment from many that would benefit from it. So thus, there's this need for more assistive programs like free health clinics, or educating the population on where they can receive free health assistance, GoodRx to help combat high prescription prices, and Medicaid. We hope that with this new information and awareness, change can come about in furthering the reach of healthcare to marginalized communities.